In lieu of our normal announcements, you can look at the back of your bulletin for those. We have a special treat for you this morning. A few weeks ago, most of you may remember that we sent a short-term medical missions trip to the Dominican Republic. And so we supported them and we prayed for them and we sent them out with our best blessings. And they came back safe and sound because of the providence and hand of God giving traveling mercies. And God really used them in a mighty way. And so we want to hear briefly about their trip in the middle of our service this morning. And so here we have these wonderful missions team partners up here on the stage, and they're going to share a little bit about their time in Dominican and what God taught them and what God did through them. And I think Dawn was a volunteer to go first. Is that correct? Yeah? So Dawn, we're especially glad that you got to go. Let's welcome Dawn as she shares with us this morning.
Hi, everybody. My name is Dawn, and sorry, I'm not used to speaking up front. So I'm so grateful to have this opportunity to go on this medical missions trip with Handful of Hope to the Dominican Republic. In this slide right here, the first day we went to a village, and we were able to give out food for people in the village that were very poor. They had to choose what family member would eat that night because they didn't have enough food to feed everybody in their family. So here you see all the lines of people waiting to get that bag of food. As they received the bag of food, what we did, we prayed with them, and we were giving them the food, and they were so grateful to have this food. If you can go to the next slide, that would be great. I had the opportunity to serve in the medical part of the missions trip in the clinic, and we saw 2,400 people in 3 days. My job was to do the vitals on every patient that came into the clinic, and I had this one guy that I saw that he was so sad because a doctor gave him a prescription for medication, but he was only able to afford one pill. And I was able to talk with someone in the pharmacy, and they were able to fill his entire prescription. So praise God, we were able to do that for him. And another thing that really touched me is just to see how many people came off that bus, and they were just so grateful to us for giving our time and just so happy that we were able to give them medical treatment, because otherwise they wouldn't be able to have this medical treatment at all. And it was just an honor to see how many people we were able to bless through the entire trip. Another thing that really touched me was going to the orphanage and just to see these children that were either abandoned by their family or beat up, abused, and they were so happy. They had so much joy in their heart because they had Jesus Christ. Even though they didn't have an earthly father, they did have our Heavenly Father, and I'm so grateful to have this opportunity to be a part of this mission trip.
So I don't have notes, so I'm just going to look at the slides as I talk through them. So on the top, you can see I just took a picture of all of us in the airport. There were, I think, 67 of us who took this trip. And for me, this was the first time I've ever done it. So getting 67 people through, loaded on the bus and through the airport and through customs and all of that was very chaotic. I got it. Don is here today. Don is the head of Handfuls of Hope, and he did such a great job getting us through there. I think I would have had a breakdown if it wasn't for their leadership. How we got our supplies down there was we each brought a suitcase and packed it full of medical and dental supplies. We checked that bag, and then we packed a carry-on with our personal items, like clothing and scrubs and stuff like that. And so we had all this luggage and all these bags. It took all day to travel, but we made it. And then on the right, you could see a picture of the bus. There's a couple buses that took us around. The reason I took a picture of that was because we spent a lot of time on there, back and forth to the village. And the first day, this is all new for me, so I've never, been to the Dominican or anything like that. I think there was more motorcycles on the road than cars, and I think a bike for one person, they somehow fit 3 people and a baby on it. So it was very, it was all new for me. I thought we were going to We made it. We made it. The first day I closed my eyes and but after that I got relaxed. The bus drivers did a really good job. And on the bottom you can see this is the church that we went to in Catalina. That's when we first arrived, and they had already set up the partitions for the treatment rooms. And that's what it looked like. And then it was, after that, hustle and bustle. So I took a picture right when we first got there. So you can go to the next. So this is, I think, one of the first stops we made at one of the villages, I think San Jose. Is that right? Okay. So on the left, you can see that there was a school there where Dawn had a picture of us handing out food. And that's a basketball hoop, so we played some hoops with the kids. I think that's a bike rim nailed to that pole there. And the top is just, that's the village that we were at. And at the bottom is back at the clinic. And as soon as we got there, it was just, we set up all these tables, and they all seemed to know this is the first time for me, but everybody knew. I just would walk in and say, how can I help? And we were sorting pills and putting labels on everything. It was very organized, but very, very busy. So you can go on to the next slide. So the top left, that's a pharmacy. I think Dawn had that picture as well. The pharmacy, I was very impressed by that. A lot of supplies, a lot of medications. It was great. To the right is the Handfuls of Hope building. And then on the bottom, that's myself and Renee, a dental assistant, and that's our dental hygiene operatory. And we just used those lawn chairs. And then if you go back, we just used a paper towel roll resting on the table, and that was their headrest, and nobody really seemed to mind. But they were so anxious for treatment that dental got very busy. It got very busy. And so they were so anxious that the patient would get up from the chair, and before I had time to take my gloves off or put those dirty instruments away or anything, the next one sat down. And so it was, they were really excited to be there, excited to have their teeth done. So that was good. And you can turn. So the top left, that's outside the building. There's the benches there. And a lot of, this is in the morning, I think, when we first got there. And so it was starting to fill up. But during the day, all those benches were full. They were full and overflowing, and they were all filled up with people waiting to be seen. To the right, that's when we were done with the clinic, and we had a church service that last night. And this is how I was amazed that within about an hour, or maybe two, I think an hour, they transformed that place from a medical clinic into a church. Just many hands make light work, and that's what happened. And then on the bottom, that's one of the villages we went to with the Isaiah 58 ministry, bringing food, bringing a gospel message. And Pastor Vernon, the pastor of the church in Catalina, he gave a message sharing the gospel. And he, I think, went ahead of us by an hour or two, and I guess made announcements that we were coming. And so that place was full when we got there. And one of the things that struck me about that, I don't have a picture of it. I don't know, maybe someone took one. But there was a young man there in a wheelchair, and the wheelchair was made out of a plastic lawn chair. And do you have that picture? Oh, okay. It was a plastic lawn chair, and I think maybe bike wheels or something, and maybe some parts of a wheelchair. And it was very, I've never seen anything like that. The ingenuity and creativity was amazing, but just the poverty also. But it worked. It got him around, but it was sad to see. Let me go next. So these are some of the lovely people that we got to spend the week with. On the left, his name is Eric. He's, I think, he said about 3 hours away, and he was there for the week helping with Handfuls of Hope. And he had his teeth cleaned for the first time. He's 23 years old, never been to the dentist, and so he was very excited about it. He was a little nervous, but he did well, and he said he's looking forward to next year, get his teeth cleaned again. And then on the right is Noemi. What a sweet soul. She was a really, really sweet soul. And she didn't speak any English, but I somehow had many conversations with her throughout the week. And she was also very excited to have her teeth cleaned. As she waited and waited the first day, we weren't able to get to her because of the patient load and so many people waiting. But she came back the next day, and I put her at the top of the waiting list. So she was really excited, too, to get her teeth cleaned. She was just full of smiles. And then this is some of the work that we did back in dental. On the left is me with a patient and one of our translators. We weren't able to have a translator. We had a translator some of the time, not all of the time, but the last day we were very grateful for him. I work in public health, and so I work with a lot of Spanish-speaking patients, but I know very, very little Spanish. And I have an assistant at my job, and she talks for me all day, and so I don't have to think about it a whole lot. But now I'm going to start paying more attention to what she's saying, so I can better communicate when I need to. But this is the translator. His name was Jeremiah, and he did a great job. You have to have a really strong stomach to work back there in dental. And he watched everything. He was very interested in it, and he did great. He didn't get woozy or anything because he was good. So on the right, just go back one, just tell you about the picture on the right. We had some very, very lovely Dominican dentist volunteers. That's a few of them. They were really, really sweet ladies. These ladies, and one of our team members there too, these ladies did extractions all day long for 3 days in a row. So all day long for 3 days in a row. And one thing, we would see these people, and I would ask them, have you ever been to the dentist? Have you ever had your teeth cleaned? And I would say 90% of them said no. Never been to the dentist, never had my teeth cleaned. So we weren't really doing cleanings. It was really much more than that. But there's only so much we could accomplish, because their whole mouth really needed to be restored. So, we wanted to do so much more than we could do, but hopefully some of them, you can't extract several teeth in one sitting. So they'd have to come back maybe next year and get some more work done. So hopefully they'll come back. I think a lot of them will. So they did fabulous work, these ladies, and they obviously didn't need a translator. So it was great. And one thing that really stuck out to me was one of the doctors who came on the trip for the first time, as well as me being a first-timer. He said, they give back to you so much more than you give them. And you think, how is that possible? Because we gave up, a week's vacation or a week's pay. A lot of us paid to be there. We bought some of our own supplies with us, our own money, and then we offered all of our services for free. And somehow we felt like we received the blessing, not them. And I think that's the genius of how God created us to serve. So it just was fabulous, and I think all of us want to go back. So thank you very much.
Good morning, church. I want to introduce myself. My name is Valerie Pena, and I'm an occupational therapist. This is my first missions trip, and I want to give a sincere, heartfelt thank you to the people of Mount Bethel Baptist, because it's because of your generous donations that I was able to make this trip. And if you're wondering why you may not know me, it's because it's only my second time here at this church. I came a few weeks ago, right before we left, for everyone to pray over us. And didn't even hear about this trip, didn't even hear about Handfuls of Hope until 3 weeks before the trip left. So, and this is my first missions trip too. I'm in my 50s. I've always had a dream of going on a missions trip to a Spanish-speaking country where I can serve. And all of you made that possible for me and didn't even know me. What happened was a friend of Dawn's named Sandy had foot surgery. She was a nurse who was supposed to go on the trip. Are you here, Sandy, today? I don't know if she's here. Because she couldn't make it on the trip, Dawn met me at a dinner and said to me, I'm going on a missions trip. Somebody backed out. She couldn't make it. You would be perfect because you're an OT and you speak Spanish. And I said, okay, great. When is it? And she said 3 weeks. Honestly, 3 weeks. I didn't have a passport. I didn't know if I can get off from work. My birth certificate wasn't even valid. I was born in Hudson County. I had to get my birth certificate reissued from Trenton. There were so many things that got in the way. But as we know, God makes a way when there is no way. He wants us to be there. He will make sure that we're there. And why is it, I wonder, that the very same God who created the heavens and the earth and the mountains and the skies and the rivers, why are we surprised when the very one who made these things can move these mountains for his children? But he moved those mountains for me, and he made me there. He made me able to be there, to do things that maybe only I could do, to serve in ways that only I can serve, not because of being better or worse, but just because my own story was needed at the time. And I was able to share my story with people. And that was a great blessing to me, that I can share things that I've gone through to help others. And by the way, when Dawn mentioned this trip to me, she was pretty much more telling me to go than asking me. For those of you who know Dawn, she has this amazing gift for thinking of others before herself and for plugging people in where they're needed. And I think that she accomplished that with me in this trip. So let me see where I am here. Okay. All right, the people that we met, as mentioned, were just amazing people. They appreciated everything that we did for them. And one thing that I learned from this trip was that they took everything as if it were a miracle. When they went to therapy, it wasn't something to begrudgingly check off their to-do list. You know, we'll say, I have to go food shopping. Oh, I have to go to therapy. I have to go here. I have to go to work. They were so grateful. They did not miss the miracle in the mundane. How distracted are we that we think of it as a chore? They think of every pain relief, everything that was done to them was a miracle. And I'm not going to ever forget that. We can go to the first slide. Oh, that's just me and Dawn. I forgot about that. That was a little picture of her telling me what to do. Okay, in this picture here, telling me what to do. In this picture here, I just wanted to capture the joy in the patients' faces after they received the therapy. Or, a little baby with Down syndrome. The lady on the bottom left, she was just jumping around with her walker, just singing and praising the Lord. Just so happy. Whether we received, gave them a splint or a knee brace or whatever we gave them, they were so grateful for it. Okay, you can go to the next one. I had to take a picture of this man's feet. Yes, those are actually human feet. Okay, and the picture does not even do them justice. They looked like leather. This man didn't have shoes. But when he left the clinic, he was just singing and praising the Lord with every inch of his being. And I couldn't help but think of the scripture, Romans 10:15, how beautiful are the feet of those who carry the good news. And he was beautiful. His feet were beautiful because he praised the Lord in whatever he did. And on the top, you can see the woman that was very happy in the last slide, just hugging us. She couldn't stop hugging us because she was so happy for what she received from us. Okay, you can go to the next slide. Okay. This baby was born at 7 months. She weighed 4 pounds, and she lost a twin brother. The mother was obviously very concerned for her well-being. I believe that one of the reasons I was put on this trip was because I could minister to this mother. You see, I was born at 6 months and 3 weeks, 1 week earlier than this baby. I weighed 2.5 pounds, and I lost a twin brother. The comfort that she received and the hope that she received from me meant more than any doctor could have told her. Because I was there. I went through it all. And that was over 50 years ago. So, that gave her great hope. So I knew that was one of the reasons I had to be there. Okay, you can go to the next one. These two beautiful little girls are now my sponsor children. They call us their madrina, their godmother. And when I first went to the school the first day, I was captivated by them. There was something about them that we just shared a moment together. And they kept looking at me, and I kept looking at them. And I thought for sure these girls were already sponsored because they have to be. But as things would have it, the little 3-year-old on the top, Ricey, was not even in the system yet, so she was available. And 10-year-old Giovanni, look how sweet she is with the dimples. She was just brought to the school new this year with her mother crying, saying that she couldn't afford to pay for her schooling. Can you please take her in? Divorced family, no father at home. And it's my privilege and my pleasure to know that their schooling will be taken care of because the money that I pay every month will go directly to them, not to how many people in a village, but directly to them. And then I can go and visit them whenever I want. It's so touching to me. I'm just very grateful that I can do that for them. Okay. Not only did we minister externally on this trip, but a lot of ministry was done within our own trip. When we went to an orphanage of girls who were very abused, I was able to share my past of having a verbally abusive mother, to minister not only to these abused girls in this orphanage, but also to another girl on our trip who had a similar past and who had turned away from God. It's amazing how, when you share a common bond, how it brings people together. I'll never forget the trip to the orphanage. And also, I brought my face painting supplies with me, never thinking that I would have a reason to use them. And at the orphanage, that's where I needed to use them. You can go to the next slide. The girls there were very shy and distant at first, but the minute that we started face painting, it was like we've known them for our whole lives. It was a beautiful thing. And what I really loved is that Alexandra was there, 17 years old. She jumped in. Oh, can I help? I've never face painted before. We have another member of our missions trip here, Gita, who is a physician in Middlesex. Let me help. Another nurse came. Let me help. I mean, all walks of life, all ages, all professions. We just sat there and we painted together, and the girls absolutely loved it. It was a beautiful thing. And I knew, and Don had said to me, that's why you brought those paints. It was beautiful. So when we minister to other people, it made me think of 2 Corinthians 1:4. He comforts us in all our troubles so that we can comfort others when they are troubled. We will be able to give them the same comfort God has given us. And I really feel that that took place on our trip. You see, God gives us our stories, not to keep them to ourselves, but to share them with others for the glory of God. So as you go about your day, try to remember to see the miracle in the mundane. And remember to share your story. The best part is we can do it anytime, any place, anywhere, and you don't need a passport to do it. Just share. Thank you all for your generous donations for me, and God bless you all.
Hi guys, buenos dias, Mount Bethel. I got to practice my Spanish on this trip. That was good. It's not very good, but it's amazing how you can have a conversation and have such a language barrier. So that was something that my mom said, and I agreed. Okay, you can go ahead, Steve. First, I wanted to address that while this trip was such a blessing to me in so many ways, one of the first ways that it was a blessing to me is because I got to go with my mommy. And we could both attest, everyone in our family can attest that she works really hard all the time. And we don't get to see each other as much as we would like. So 6 days with her together, just laughing, just sharing this amazing experience was incredible to me. So love you, Mom. Okay, you can go to the next one. All right, so I have a couple things on here. I was able to serve wherever I was needed, which was great. So wherever anybody needed help, I was happy to be there. And that included giving out food, as Dawn already described, with a new friend of mine. Watering bags was pretty interesting, so the culture shock there was pretty interesting. On the bottom, you can see me with a couple of the kids. I love those kids. One of their favorite games is running back and forth across the courtyard. And, after you would touch the wall, they'd be like, again. You'd be like, oh my gosh. And it was like 90 degrees. Okay, again. You'd run back, but their joy and their hugs, and the Dominican people love to give hugs. And so I think I've been hugged on that trip more than I have been ever in my entire life. And I was so grateful for it. And then on the very right there, you can see some of those face paints. That's the picture that I was able to pull as Valerie was talking. And that part was actually just as much a blessing to me as I think it was to Valerie. Just seeing those kids be so happy, even though I was messing up their face paint. I was trying. And I met this 17-year-old girl who did not look like a 17-year-old girl at first, but then it's hard to tell, right? And I was painting her hand, and I was talking to her, and she was speaking to me a little bit in English, and I was able to talk to her and relate to her. And I was amazed that there's this 17-year-old girl my age across the world going through just a completely different life experience than me, and yet we were able to laugh together. We were able to talk to each other for 30 minutes, and she touched my heart in a way that I think it's inimitable, it's undescribable. Okay, you can go to the next one. All right, so this morning I had my hair braided, but I had to take it out, which was very sad. I was going to keep it. But there's that wonderful woman named Noemi, who my mother was talking about. She braided oh my goodness, like 20 girls' hair when we were there. And it was wonderful to get to talk to her. And that was just such a wonderful little remnant of my trip that I could take home. And it was a good talking point in school. Like, who did your hair? Oh, Noemi. Let me show you my pictures from the Dominican Republic. Let me show you what we were able to do there. You should come. So that was good. And then on the right is this wonderful woman named Flor who only speaks Spanish. And we were able to work with her in the school. And we became buddies this trip, me and Flor. And I was so glad to meet her. She's just a wonderful, sweet, wonderful woman. Do I have another one? Okay, so in conclusion, I know that Handfuls of Hope, Hi Dawn, is doing another trip this summer. And I'm not even joking. The minute I got off the plane, I whipped out my phone and I texted my friend that you guys know. She comes here sometimes. Her name is Taylor. And I said, there's another one happening this summer. You're coming with me. We're planning right now. So that's in the works right now. So if we could use your prayers with that. But I'm basically raring to go back and so excited for the way that they were able to bless us too. So thank you guys. Thank you so much for the opportunity to do this. I know we all share that.